Discuss this is the president of chairman of council, Nigerian Institute of Public Relations, Mukhtar Sirajo. Mukhtar, it's good to have you join me right now. Before you are joining me now, we've been talking about the issue of communication and how to carry people along. Do you think basically this is part of the challenge that we have on our hands talking about coronavirus?
Thank you for having me. First of all, I would like to say that so far the steps taken by the federal government of Nigeria and the various state governments, particularly I want to mention Lagos and Kaduna states, have been quite wonderful, proactive, and I believe they have gone a long way in ensuring that, of course, they couldn't stop the pandemic from hitting us here, but at least they've gone a long way in trying to mitigate the impact, even though we are still counting. But like the statement we issued sometime last week, while commending the government, we believe that in every human endeavor, there is a room for improvement. And we did take the government out on the issue of probably not enough engagement with critical stakeholders when it was in the process of coming up with proactive steps to handle the pandemic. The statement came out right at the time that the government and the Nigerian Medical Association seemed to be involved in an altercation over is either the invitation or the acceptance of the offer of the Chinese for assistance in handling the pandemic. And we said, much as the pandemic is a medical issue, it is a crisis nonetheless. And crisis communication, therefore, needed to have been part of the input in handling this thing. I did mention then that even in the process of enlightenment, you have to ensure that you craft messages that have the real and correct impact on the people. For instance, the message that you craft and issue to the man in Lagos could be different, should be different rather, from the message that you send to the man in Anawaki in Katsina. Well, the message may be the same, but the manner in which you craft and convey the message should take into account the nuances and the peculiarities of the people that you are trying to actually communicate with. So crisis communication is very, very essential. And we did mention then that if critical crisis communication methods had been involved, for instance, if the Nigerian Medical Association had been involved ab initio, the little embarrassment that the country almost suffered with the invitation or the acceptance of the offer of the Chinese might not have arisen. Perhaps if the NMA had been involved and they knew that there was something like that from the background, they could have made their positions known, certain steps would have been taken, and probably there would have been no noise about it. It would either have been jettisoned or some certain compromises would have been made that would have accommodated our own peculiar realities.
All right, so Mukhtar, let me interrupt you a little bit and bring another dimension. Now, in the Third Republic in the early 90s, we saw an organization like MAMSA that was very effective, reaching out to every village and every local government in this country, disseminating information and all of that. Now, we had done this before. We have achieved that level of impact and effectiveness before. Between that time and now, what do you think is the difference when it comes to the approach to reaching out to people? When we have all the gadgets now, and we have more enlightened people if we have to compare them between now and that time?
I still will go back to the point that I was making. But in fact, it should have been a lot easier now with the communication is facilitating a lot of things. The internet, the ICT dimension that you have mentioned. But in those days, I want to believe that uh, communication strategies, especially crisis communication strategies, were professionally handled, and it was given to professionals to actually handle. But I want to say now, with all the good work that has been done, I must actually emphasize, not taking away anything from what the government has done. I believe the NIPR believes that we have not fared badly, but if the communication dimension had been handled more professionally, I believe that we would have been at a place that is a lot higher than where we are now. So, but I believe it is not too late because this country is not bereft of people, of ideas. This country is not bereft of professionals in the communication sector that can really lend a hand of support to the government. We are doing it in our own little way, but there is a limit to how far you can go about doing it on your own. I mean, if you're not integrated in the system that is handling it, whatever you do will have very limited or minimal impact. But I want to say that once you get the communication aspect correct, more than half of the job is done.
Okay. We have to leave you here now. Mukhtar Sirajo of the Nigerian Institute of Public Relations. Thank you so much for talking to us on TVC View. Mukhtar, it's good to have you join me right now. What would you describe? What would be an ideal communication plan that Nigerians, to the grassroots, everyone, every corner can get the information as it is meant to be, whether you understand English or you don't understand?
Thank you for having me back. Like I said earlier, when you are in a heterogeneous society like ours, where we are one, but of course, God has endowed us with the kind of diversity that He has. You have to be really deliberate in the way you go about wanting to communicate with the people. And crisis communication is not an all-comers job. It is something that you really need to be trained on. Like I said earlier, you have to look at who you are communicating with, the level of the intellect of the person, even the cultural nuances, the cultural differences, the religious, the differences in faiths, and come up with a strategy, with a mode, with a method of communicating with that person in such a way that they understand really what you are trying to tell them. Like I said earlier, you may have the same message on the pandemic that you want to convey to the people of Nigeria, but how you convey it means a lot. You may convey it in a manner
Mukhtar, if you analyze the level of communication now, the strategy and the plan and the structure, would you say they're communicating well, or what is missing?
I believe they are not communicating badly, but there is a lot of room for improvement. In fact, when you talk of structure, sometimes the formal structure is not it. Where you use television and radio and newspapers to communicate with some people, in some other areas, you go down the ladder, you talk to their clergy, you talk to the imams, you talk to the pastors, you talk to the traditional rulers. Once they ask the people, once they tell the people this is the way to go, the people go there. So even the choice of media is very, very important. And that's why I argued earlier on that when you want to do this, you want to have not necessarily experts, but people knowledgeable in the communication business. so that they can sift the wheat from the chaff for you. They don't just lump everything together. When, like I said earlier, you communicate to the person in Lagos with the same product, but the means of communication may be different from the way you communicate with the person in a village in Katsina. You want to convey the same message, but people are different. Their orientations are different. Their cultural norms are different. The level of understanding, even the literacy level, I mean, let's face it, is different. So you have to come down to the level of the people to be able to properly and effectively communicate with them. And let me tell you this. One other thing that I think, in communication, we believe there is always a silver lining, however bad the situation is. If you think positively, you can make the best of a bad situation. I think this corona pandemic, even though you have not asked about this, I'm a bit digressing, but I think our governments need to know this. It has afforded us an opportunity to take a critical look at our healthcare system. We are in a situation now where we are stuck, everybody is stuck at home. Before now, every little headache, every little fracture you have, you want to fly somewhere and get yourself treated. And I believe this was what led to the comatose nature that our healthcare system is in now. But now that we have found ourselves in this situation, I want our governments at all levels, local, state, federal, to take a hard look at it and ensure that our health sector becomes a major beneficiary of this crisis by ensuring that we upgrade to a level that everybody would have very
We'll be proud
little.
of. Okay. All right. That's a prayer of all Nigerians as well, to have improvements in the health sector. Thank you very much, Mukhtar Sirajo, President and Chairman of Council of Nigeria Institute of